always exciting because you never know where Murphy's Law is going to kick in. So, okay, but I'm glad we at least have our first slide. And the reason I wanted to put up this slide was to emphasize the fact that the power has completely shifted in today's day and age. And there used to be a time when we would think that, the hospitals were kings, doctors were God, but the reality is that's not true anymore. And it's high time we realize that. So the hospital's CEO dream is really very simple. You want 100% bed occupancy. You want to be thought of as being the hospital of first choice for your patients. And you want patients who are delighted with you, so they will keep on referring even more patients to you. And of course, if all this happens, then you will get happy staff members as well. But just like you have dreams, we have nightmares also. And what are these nightmares? Angry patients. And when do you get angry patients? When you have arrogant doctors who think they know everything and then don't have time to talk to patients. As a result of which you then end up with malpractice suits for negligence because no one ever bothered to take an actual informed consent from the patient. And then of course you have unhappy staff because if patients are unhappy, they're going to have to vent and they need to take out the anger on the staff. And this of course is what causes bad reviews online. And you should actually Google this on consumer complaints and see what reviews are for Apollo Hospital or Fortis or maybe even your own hospital to know what patients actually think about you. This of course is becoming increasingly common, which is why now doctors are running scared as well. And this of course is everyone's major nightmare. You open up the Times of India and at some point it's going to be some hospital, something bad happens and you just count your blessings. Thank God it wasn't me. But trust me, sooner or later, it is going to be you. Hopefully not yet, but I think we need to step back and understand that today, no one likes the idea of going to a hospital. There used to be a time when hospitals were considered to be sanctuaries. You have a problem? No problem. Go to a hospital, we will take care of you and make sure that you get better. Today, it's associated with rude staff, rude doctors, too many bills, illness, fear, pain, all negative connotations. And of course, patients are unhappy with the medical profession today. Where is the family doctor of old? Doctors are very commercial, they're very professional, all they want is money, they're just too busy, they just want to order tests and more treatment and refer patients to each other. And everyone wants to think about what things were like in the past. And the first thing today when you talk to patients about doctors, this is what they think about. Am I really going to have to spend so much money? And it's not like they mind spending the money, but they're not sure that that money is being put to good use. And this is what the reality is today. It's no longer doctor and patient. The entire relationship, the trust factor has gone for a toss. It's become a doctor versus patient relationship. And this hurts both doctors as well as patients. The fact of the matter is that patients are becoming increasingly articulate. They want information. But because their doctors don't have the time to provide this information for them, they go to Dr. Google. And then this becomes both a challenge and an opportunity, not only for doctors, but for hospital CEOs as well. We all know what happens. People doctor shop, they don't trust the doctor. Doctors get beaten up when anything goes wrong. It's always the doctor's fault. Never mind what happens. Of course, the doctor was negligent that the patient died. And doctors, get beaten up, they go on strike, hospitals get burned down. This is just going from bad to worse. Let's just pause for a minute. If we continue down this pathway, all we'll have is politicians trying to run the roost who have no idea about what real life medical care is. When are we going to be able to bring this picture back again? This is what we actually became doctors for. And let's not forget, the reason we are willing to go through 7 years of medical college, 3 years of postgraduate specialization, doctors are pretty smart students, they usually got A grades, is that because we wanted patients to get better. Let's not forget, medicine is a service profession. We like our job, we like what we do. And that's the question we need to ask ourselves. And I think the one solution which actually fixes all these problems, something which is inexpensive and a great cost-effective investment, is what I call information therapy. And the magic sauce is it allows you to get new patients, it allows you to delight your existing patients, and your doctors don't get bored saying the same thing again and again, because guess what? The information therapy you prescribe on your website does this for you. And it helps with risk management because you're documenting the fact that you're then making sure patients are providing informed consent. What is information therapy? It's actually extremely powerful medicine because it allows patients to make well-informed decisions. Because I think we keep on talking about how unbalanced the doctor-patient ratio is, but the mistake we make is we forget that patients are the largest untapped healthcare resource. Can I ask all you guys a question? How many of you have been patients? All of us, fair enough. How many of you think you're intelligent? All of you. Which means if you think you're so smart, why do you insult your patients by thinking they're not smart enough when they come to you as a patient? Of course they're smart. And if we don't tap into that intelligence, I think it's doctors and hospital administrators who are to blame. And the trick, of course, is to empower them with the right information so they can take better care of themselves. And trust me, you're not displacing the doctor by doing this. You're actually strengthening the doctor's hands. Good doctors appreciate patients who have realistic expectations. And the most dangerous patients are the ones who say, Doctor, aap Bhagwan ho, sab kuch theek kar lo. I always tell them, agar main Bhagwan rehta, to main clinic mein nahi baithta. I would have better things to do with my life. Anyway, so what does information therapy do? It allows patients to save money on medical care. This is extremely important. It tells patients, look, not every little cough, cold, fever, sprain, you don't need to go running to a doctor for every little thing. Lots of stuff you can do for yourself. You're not completely dependent on your doctor. Equally important, it provides evidence-based guidelines so that you can check whether what your doctor is providing you is sensible advice or not. And most importantly, it allows patients to say no. When the doctor says something which doesn't fit in with guidelines, say, I'm not sure I really want to do that. Or doctor, can you explain to me why what you're suggesting is so different from what the guidelines are saying? I think this is the elephant in the room, whether we acknowledge it or not. And all patients are going to Google right now. And you're not going to be able to change that, and there's no reason for you to want to change that. I think you need to leverage that, and you can use the internet to establish a more positive relationships. The fact of the matter is, doctors are busy people, but Dr. Google is available 24/7 and it's free. So patients will use it for researching their treatment options. But the trouble with Dr. Google is it's unreliable. A lot of information is outdated. It's completely wrong sometimes. A lot of it is commercially biased and you really can't trust. And imagine the poor patient's plight. He goes to site A, such and such is the best. He goes to site B, diametrically opposite information. He gets so fed up that he doesn't want to go to the internet. And then he comes with this huge printout to the doctor, and the doctor gets so pissed off. He says, if you're so smart, then why don't you go to Dr. Google and take your treatment from him? Why are you coming to me? But this is not a healthy way of approaching the problem. I think let's accept the fact that patients are being forced to go to Dr. Google. We as doctors and hospitals have let our patients down. The word doctor is derived from the word dossier, which means to educate, which means to teach. And if we taught our own patients, there would be no need for them to go to Dr. Google. They'd be very happy to get the information from our website. Today, this is what started to happen. But doctor, I read this on Dr. Google, I did this, I did that. And it's got to be your hospital website. And it's far better positioned to be helpful to your patients than Dr. Google ever can be. Remember that. You know you need to provide your patients with reliable, updated information because this is what builds trust in your hospital. You need to create a brand for your hospital. And digital is the best way of doing it. Because you need to go to where the patients are. And guess what? All the patients are already online, which is why you better make sure you're there. But the problem, of course, is how do you ensure that the content on your website is actually world-class? Because the reality is not all information is created equal. And if you actually look at most Indian hospital websites, they stink. Can anyone tell me why? Why are they such poor quality websites? Whether it's Apollo, Fortis, Max, Hiranandani, anyone? You know, the problem is the website is all about the hospital. I have 1,000 doctors, all these doctors have all done these fancy degrees, I did liver transplants, I do kidney transplants. Who cares about you? The patient only cares about themselves. So unless your website learns to put the patient first, the patient isn't going to care. And that's the biggest mistake hospitals do. And I think part of the problem is hospital administrators don't understand all this, and they need to learn to evolve. It's a great opportunity for reaching out to patients. Why shouldn't your website be the trusted digital destination for health information for the entire community? Why should they want to go to anywhere else? And the fact that they're going somewhere else means you're not doing a good job. It should be all about the patient in that local language. You actually have an edge compared to Mayo Clinic or Johns Hopkins. Those poor guys will only provide information in English and maybe Spanish these days. Of course, lots of them are doing it in Middle East languages also because they want all these rich sheikhs to come to them. But all these local Indian languages, it's an entire vacuum. Why aren't you taking advantage of the first mover advantage? Why are you guys sleeping? And the beauty is you're actually allowing your doctors to become the heroes. You're giving them a platform to share their expertise. And it's your nurses and it's your technicians who should be featured on the website. It shouldn't be all about you. The reason there is such poor content on the website is because websites focus all about the hospital and not on the patient. And this is when the opportunity for trust building is being lost. We need to give the patient what he wants. Now, if the patient has chest pain, he doesn't care about you're doing liver transplants. He wants to know what's the reason for my chest pain. How can I be sure it's not a heart attack? How can I be sure that I'm not dying? How can I be sure that it's not just acidity? And you need to provide him with information which he can trust. Take advantage of this opportunity. And, why don't you look at the mayoclinic.com website? I'm sure I don't think any Indian hospital has that brand name or recognition, but compared to Mayo Clinic, they do such a bad job. And yet we continue calling ourselves world class. And I think this is part of the problem, because this is not something which most administrators have done before. This is what they feel they are like, they're completely lost. And I agree with you, it's not an easy task. Let me emphasize this again. It's not an easy task. And people underestimate how difficult it is. Let me tell you, writing high quality medical content for patients is difficult and time consuming. What do we think? Oh, we have so many hospitals, we have so many doctors, we have so many nurses. We'll tell them to write, but guess what? Doctors can only talk in medical jargon. They're great at talking to other doctors, but they're terrible at being able to talk to patients. It requires a completely different mindset. The great news is now that you can license this information. You don't need to reinvent the wheel. It's not even very expensive. And Healthwise is a non-profit organization. It's located in the US. And I'm going to talk a little bit because I think they are world leaders in what a marvelous job they've done. The information is updated, easy to understand, completely reliable, so you don't have to worry about the content. It's encyclopedic. It covers everything anyone could possibly want to know. So it's not very piecemeal. It's actionable. It's not just information for the sake of information. You can actually use that information to make better decisions. And they keep on evolving this all the time. And it's simple, plain language. Quite frankly, I think your doctors would learn a lot about how to talk to patients by looking at some of this language. And the beauty is, as far as your legal team is concerned, Healthwise takes full responsibility for the content they provide. So no one is ever going to sue you for the content which they read on your website. That's Healthwise's responsibility. Makes complete business sense for you. Your website creates a lot of patient loyalty. Ideally that's where you want patients to go anytime they have a problem, whether it's a minor problem or it's a major problem. And you become the trusted health provider. You are top of mind. That's that brand positioning which you actually get to enjoy in the consumer's head. And very importantly, you actually reduce the risk of malpractice suits. You can document the fact that we provided this information electronically to all the family members. So they can't say, Doctor ne humko samjhaya nahi afterwards. And of course, it creates branding. I think we need to understand that the hospital market has become an extremely competitive space in India. I'm not talking about the bottom of the pyramid, but definitely for creamy layer, every hospital wants to do liver transplants and kidney transplants because they make a lot of bucks. And you need to create patient loyalty. And the best way of doing that is to ask yourself, will this patient who's now in my hospital, when his relatives or his visitors fall ill, will they come to my hospital or will they go somewhere else? This is the classic net promoter score and the word of mouth branding we need to be thinking about. And really, what makes you better than anyone else? Can you provide a unique differentiator? And I think rather than waste money on generic ads in newspapers, this is far more focused, because you're approaching patients at their time of need, when they feel that, yes, I have a problem, I need medical attention. I think this is extremely important. You don't need to employ marketing guys who go around to doctors and say, हम तुमको 10% commission देगा, हमारा bed भरो, हम तुमको kickback देगा. Why do you want to waste your money doing all that kind of rubbish? Patients are online. Why don't you just reach out to them directly? They want that information, and if you provide that information, they will be grateful. They will trust you and they will come directly to you. This is what the HealthWise knowledge base looks like. There's lots of it. But it's not one thing which you do in isolation. Remember that. Just putting it on your website will not help. It has to be an integrated program, an online marketing program. You're providing content, but you need to leverage that with SEO, with Google AdWords, or if patients call, please call our number. We will connect you to a call center. Ultimately, the call to action has been, yes, we've provided you with the information, but you need a doctor to actually write the prescription for you. You need a doctor to actually take out your ECG, and guess what? We're the right hospital. Come to us. It's very cost effective. And if you have a call center, then you actually have an Ask the Health Expert coach who can ask your queries. Lots of benefits. You're not just treating illnesses, you're actually promoting health. You're proactively helping your patients. You're outreaching to the community. And this is a major differentiator. You stand out from all your competition. And this is something, it's, I think, high time we learned from the US. All US hospitals, health insurers, they all use this content on their website. It's a value add because it allows you to engage not only with your existing patients, with potential patients. All of us are potential patients, never not forget that. And it helps us to create trust and loyalty. Why is it so cost effective? Because it's a one-time investment and it just keeps on paying dividends all the time. You're actually creating patient delight. Imagine the amount of confidence the doctor will have in your doctor if the doctor provides exactly the same advice which he's read on the website, and you can keep on building on it. But that's not enough. You can actually use this to help your doctors to talk to your patients, because I think this should be the biggest nightmare. If a doctor is rude to a patient will not forgive that. And God forbid, if that particular patient has a bad outcome, that patient will be vengeful. और गुस्सा किसके ऊपर निकालने वाला है? डॉक्टर के ऊपर तो निकालेगा, लेकिन हॉस्पिटल मैनेजमेंट के ऊपर भी निकालने वाला है. So you can improve doctor-patient communication, and doctors are busy people, and that's fine. They can refer the patient to the hospital website saying, you know, you have more questions, go to the hospital website, all of them will be answered. And because the information is so easy, it actually helps to improve the doctor's empathy and bedside manners. And doctors are happy because it reduces their risk of being sued as well. What's my personal experience been? I am a full-time practicing doctor, and I learn a lot from my patients all the time. I actually treat them like unpaid research assistants. Yeah, go find whatever information you want, come and educate me. I don't agree with everything you find, but if I disagree, I will tell you why I disagree, and I will write about it on my website so that other patients can benefit from what my expert opinion is. The reality is, if you treat patients with respect, they will respect you in return. And I honestly believe patients get the doctors they deserve, and doctors get the patients they deserve. But well-informed patients are a pleasure to treat because they have realistic expectations. You can actually help your patients to talk to your doctors as well. You can get rid of all the jargon. You know, doctors love using all these fancy words. They will love putting patients in their place. And I think that's actually a sign of a bad doctor. You remove the fear element. You're trying to help the patient. You're trying to tell the patient, look, we are helping you to get better. And you need to help your patients to ask intelligent questions so that doctors will answer intelligently. This, for example, is the acronym we use at the library, what is called SAFE. S is for the story, A is for the assessment, F is for the fears which the patient has, and E are the expectations. What does the patient expect from the doctor? I just can't believe why every hospital in this country doesn't have a patient education resource center. You have a captive patient population. You have all these relatives and visitors who are sitting there waiting for their patients to get better. This is a great time because they're very aware of their own mortality. They understand that they can fall sick. They have tons of questions. Why can't you utilize this time? And in fact, the fact of the matter is that NABH and JCHO require that patient education be documented. And for a brand like Mayo Clinic, patient education is actually a profit center. They publish books on the Mayo Clinic Guide to Healthcare, the Mayo Clinic Guide to Kidney Disease, because patients read that. And when they have a problem, they understand that Mayo Clinic is a trusted, authoritative resource. This can be a fancy patient education resource center. This is what our library looks like. But you can actually do it within the hospital itself. You can do it through your TV channels. You can do it through your smartphones. You can actually provide a librarian with hand-holding guides. And people have smartphones. You can actually use Wi-Fi and use beacons to be able to beam information to their own devices. Or you can actually set up little patient mini education centers so that patients are encouraged to ask questions and they're not eating into your doctor's valuable time. There are librarians to help them find the information. But here's a simple provocative question I'd like to ask you. You go to a hotel and you will either find a Bhagavad Gita in each hotel room or you will find a Bible in each hotel room. Why can't you find a patient education guide with your hospital brand in each patient room? Let the patient take that guide home. At some point he will remember, oh yeah, I had a headache. Let me look up this guide. This is what it says. And guess what? This guide has come from this particular hospital. Why don't I call them up and make an appointment for myself? This is my last slide. I think rather than think of ourselves as hospital administrators, IT specialists, CEOs, all these silos, we need to think of ourselves as patient advocates so that we can bring the trust and healing back to the doctor-patient relationship once again. Thank you. And I'm always happy when there are no questions. That means obviously it was such a great presentation that all your questions have been answered and therefore there's nothing left to answer. So I'll leave it at that.
We can have the question and answer round. Anybody ask? Anybody want to ask any question? Yes, please.
We have a help network platform. The founder is here. The facilitator Anju is here. How many hospitals in Mumbai are actually making use of this platform? I would like to know.
So that's what I say. I have failed miserably over the last 20 years. I have not been able to convince anyone that this is what they need. And I accept the fact the failure is mine and I'm ashamed about that.
Okay.
So I honestly don't understand what the missing piece is. And I think if we don't address it, it obviously needs someone smarter and brighter and more intelligent and more connected than me. But I think it's high time that something like this was done, because otherwise this gap between the doctor and patient is just going to progressively keep on increasing.
I was chatting with a young quality assurance professional from Bangalore last week. He did mention that, is Dr. Malpani coming? I buy a lot of books from HELP on patient related issues, safety, quality. I keep learning a lot and implement that in my QA implementation. I was really surprised. Then I was just wondering, with such a beautiful system that is created, like I guess let's start from the home turf. All the Mumbai hospitals can make use of it, and then let's take it viral. Maybe we'll have to ask Dr. Rana from QAI to do something about it.
Thank you very much. And I think a good suggestion. And thank you very much, Dr. Malpani, for a wonderful presentation. And I really admire the things, the passion you have brought in connecting patients and the doctors. And I think that is the only and the most important missing link we have. We are not able to connect with our patient as a doctor, and thus we go to Dr. Google and come with so many things. And then as a doctor, we say, okay, I'm not going to even look at you. Forget how to talk to you. So I think that's the most, I'm a patient at the moment for last 3 months. So me in my situation and me in my position have faced this problem. So I can imagine with the patients who are unknown totally for a doctor. So I think it's a good thing, and we was talking about that we have to make use of your expertise and the presentation you have put on, how to connect doctors to the providers to the patients in a more effective and efficient way. So I think we would work for that and make sure that you have not failed. We all have failed basically. It's not your failure; it's the failure of everyone, because
Absolutely.
we all are responsible equally for making healthcare better. Thank you very much.
No, I think that's very kind of you. Again, the reason we started the library was more a proof of concept. We're not saying come to the library. We're just saying, look, it's possible for everyone. If I can do this, it's possible for anyone and everyone to do it. You know, one of our dreams really was that the Medical Council of India would make it compulsory for every doctor at the time of graduation to create their own website. It would force doctors to be open, transparent. You can't lie on a website, you'll get into trouble. It will create content in local languages. Patients trust that content because it's coming from your trusted local doctor. It saves the doctor so much time because he doesn't have to say the same boring 20 different things which he does every single time. So even while the patient is waiting in the reception area, the patient can read that information. So I think, you know, the tragedy is we think of ourselves as an IT powerhouse. But the reality is there is more information in Gujarati health information which comes from the UK, because they care about their minority community in places like Manchester and Birmingham. And the UK NHS creates more Gujarati health language content than we Indians do. We should be ashamed of ourselves. But, you know, I've been crying for a long time now. I just can't stop doing that.
Sir,
Sir, I wanted to understand if you have actually approached the medical colleges, because if you actually educate the, the growing people, the people who are going to come to actually converse with their patients in their language, that will make a huge difference. Because most of the graduates I've seen, when they talk to their patients, they usually have an American accent, which a local or a rural population people will never actually relate to. And that's the reason why the gap is increasing.
You know, so if I were the dean of a medical college, I would say before you graduated, we would insist that you make 10 YouTube videos in Marathi if you happen to be in Mumbai about these problems and release them on YouTube. Maybe 10 will be crappy, maybe 10 will be excellent. What difference does it make? We will grade you on that. Doctors can be very competitive. So I think these are simple solutions. Unfortunately, I talk to everyone. They're all very nice and polite because they're listening to Dr. Malpani. And what happens at the end of it? Big fat zero. So that's okay. I've come to terms with that now.
sir, by creating a website, probably we are not going to abolish the whole problem. It is the one-to-one interaction between patient, doctor and his relatives. That is more important. And if I am not wrong, all over the country, 99.9% of the doctors are doing this thing. But as there are bad people in each field, so we have got, and they are never going to be changed.
You
Let me speak. Regarding litigations, how many surgeries are done daily in this country? How many surgeries are done throughout the year? And how many patients are examined by doctor, right from a private practitioner to a liver transplant surgeon? And how many litigations, what is the percentage of litigation? Why, like media, you are trying to project that doctors are criminals?
Do I have a chance to reply to
I am
that?
practicing since last 35 years.
Can I reply to that?
Definitely.
I think FaceTime with a doctor is extremely important. I am a full-time practicing doctor. I'm not trying to be a doctor basher. Please understand that. But because FaceTime is at such a premium, a lot of the boring, routine stuff which doctors don't like doing can easily be done digitally. And when it's done digitally and you see your doctor's face on YouTube telling you what the questions are, what the answers to your question is, I think that increases the trust and the confidence which the patient has when the patient spends that 5 minutes with you in the clinic. You cannot increase the amount of time which a doctor has. That is a major limitation. And coming back to how many patients sue doctors, the reality is a lot more doctors deserve to be sued. But the fact of the matter is that sometimes patients don't even understand that they're not receiving high quality treatment. So telling me that doctors aren't getting sued is not evidence of the fact that high quality treatment is being consistently provided. I think if we take the approach that we are beyond reproach and we are perfect, we are never going to be
Nobody
able
is
to improve.
perfect. This world is not
I
perfect.
would-
We are not
exactly.
perfect.
So since we are not perfect, why
Sir,
don't we try to improve? Sure, we do lots of great
everybody
things.
wants to improve. That's why people are come and have here. There are these conferences, but the way in which we have projected the medic was a doctor, I think that's just like what the media is doing right now.
You know, I
highlighting
think
the small
okay,
points.
You're welcome to your interpretation. I don't think my interpretation is I'm a doctor basher. My interpretation is there's lots of opportunities for doctors to improve the trust which patients have, and I think that's a lost opportunity if you're not making it up. We cannot afford to live in our ivory towers and assume that everything is hunky-dory and well. I think times have changed and we need to change with them. That's what I believe.
Hi, I had a question. Have you heard of a US startup called as Outcome Health?
That's the one which had that fraud case against the two founders.
Correct, that one. But it is probably the biggest step someone has taken in terms of doctor-patient interaction, right?
I think it was a good step. It was completely misguided. Anyone who does things fraudulently, I think you should worry a lot.
Correct.
And you're right. Pharmaceutical companies, health insurers, and government have a huge role to play in patient education,
Correct.
especially health insurers. See, I think we all understand the theory. In real life, none of this ever happens in practice, and I can tell you from hard experience for the last 20 years. I was very hopeful when health insurance was privatized in India. I said, great, you know, all these companies will come and will make sure, because they don't want doctors to overtreat patients unnecessarily. Never happened because health insurers are not profitable as yet, so they don't have the money to spend. I was very hopeful that the government would invest this money, you know, rather than spend all that money on so many fancy things. So I think there are lots of opportunities all the time, and it breaks my heart when we don't make use of them. My heart will continue to remain broken, like I said, until someone smarter than me comes along and fixes the problem. But the opportunities are definitely there.
So my question was that can we bring the Outcome Health model to India where like we use technology?
We funded, I'm an angel investor. I funded a company called PEAS about 8 years ago. PEAS stands for Patient Education Awareness Services. They create videos in 8 different regional Indian languages in the form of animated cartoons. They got pharma companies to distribute some of these. But, you know, it's not an easy ride, let me tell you that.
So we also have a startup which is basically in the healthcare space. So what we are is an application basically for doctors. So we can definitely get in touch post this talk if we can figure out like some. So as you mentioned,
I'm very much around, happy to connect with you, sure.
So as you mentioned, like it has to start by like educating the doctors. So would love to like have a chat on that.
Sure.
Thank you so much.
Thank you so much, Mr. Malpani, for your wonderful speech. Now, I would like to request Mr. Joy Chakrabarti, please come on the stage to give the appreciation certificate to Mr. Malpani. Please give a round of applause.